What is a fusion in the first place? Taking those two bones and making them become one. The artificial disc is right here. It often takes, 6 weeks to heal from a surgery. I'm Dr. Kamal Woods, and I am a board-certified neurosurgeon and minimally invasive spine surgeon in Miamisburg, Ohio. I want to welcome you to our second episode of the Vertrae 360 podcast. Today we'll be talking about the motion first mindset. And it's a practice philosophy that I have adopted, and all throughout Vertrae we talk about that motion first mindset. Many patients come to us and they are terrified of having spine surgery. And one of the things that really is a turnoff for them is this idea that they need to have a spinal fusion. And fortunately, we have sort of moved away in this practice from that fusion mindset. And it's not to say that fusions are bad. It's not to say that some patients don't need a fusion. In fact, there are certain patients that a fusion is the right surgery for them. I think of patients that have fractures, trauma patients, patients with tumors, major deformity, and so on and so forth. But for a lot of the patients that we see with neck and back pain that's caused by degenerative change, by the aging process, it's really not ideal to have to undergo a fusion. Let's talk a bit about kind of what that means. What is a fusion in the first place? So if we think of the spine, I usually say that each segment of the spine is sort of like a tricycle. There are two bones. Let's say that this one is C5 and this one is C6, and you've got two bones adjacent to each other, and in between them is a disc space. And that disc is soft material. It's made to act as a cushion and to dissipate forces. And to complete that tricycle analogy, that disc is in the front, and so that's kind of like that big wheel in the front. And then there are two other joints in the back as well that are called the facet joints. So a spinal fusion, whether it be in the neck, a cervical, or in the back, a lumbar fusion, involves taking those two bones and making them become one. And the way that is done is either the disc space in the front is removed and replaced with bone, and bone bridges across that gap, and or the two joints in the back are fused together so that there's no longer movement between those two bones. And so those two adjacent bones, along with the disc space and the facet joints, we often refer to as a segment of the spine. So spinal fusion involves taking two adjacent bones, that segment, and bridging across with bone. As you can imagine, that has some consequences. On a small scale, it means that there's a loss of that motion between those two bones, but they're also kind of the bigger picture things. There's a change in functional ability of that person in terms of flexibility and movement. And there is good news in the sense that there are many bones along our spine, and so adjacent bones, adjacent discs and joints compensate and make up for that loss of motion. But that too has its consequence. That increased stress that's transmitted to the adjacent discs can lead to down the road problems. The real challenge becomes, how do we fix neck pain and back pain and the associated arm or leg problems, whether it be shooting pain down the arm, shooting pain down the leg, numbness, tingling? How do we treat those things and not do a fusion? And that's that motion first mindset that I mentioned earlier, where when we look at a case, we're always thinking, is there a way to do that, to treat that patient and to not have to do a fusion? So one of the first parts is we look to see if we can do the surgery without putting any implants in the patient at all, because we can maintain, by doing so, the normal, the native motion in their spine. And so many times, a good example would be if there's a herniated disc, there's a disc pinching a nerve. Well, if we went in and cleaned out that disc that's pinching the nerve, we don't have to put an implant in there, and we can maintain the normal movement of the spine. In some cases, though, there's enough wear, there's enough degeneration of the joints, the discs, and even the facet joints, that it's necessary not just to take the pinching off the nerves, but to create some new mechanics to restore the normal movement that has been lost. So in that case, there are now implants that we can use to do disc replacements, for example. And as I talked about with our tricycle analogy, a disc replacement essentially is replacing that front wheel, is taking out that disc and putting an artificial disc in there. And those artificial discs they're different ones that are on the market that are FDA approved in the United States. Many of them are a combination of part metal and part polymer, where that polymer is sort of like a more rubber material. And there are others that are made of all metal. And the metal could be titanium. There are others that are a mixture of different alloys. And so there are different products that are available. But the ultimate goal is to change that front wheel and to replace it so that we can maintain movement there. There have also been some attempts to try to replace the joints in the back, the facet joints, and to put a device in the back of the spine that maintains movement. And those have not been historically very successful, but interestingly, there is, I think we're right on the cusp of a new era in spine surgery. We were a part of an FDA trial looking at a new device that aims at trying to replace all three wheels of the tricycle. And I think that this kind of emerging technology is going to offer a lot to patients that have degenerated joints that need more than just a cleaning out type procedure. Now, I have an example up here of a patient that had surgery, and this is a patient that had a disc replacement in the neck. And if you can see what I've got here, this is an x-ray. On the left side, the patient here is bending their chin forwards, and on the right side, they're bending their neck backwards. We call that flexion and extension. And the artificial disc is right here. So we've got an example here of a patient that had surgery. They had the C5-6 disc replaced. You can see the metal there. That's the artificial disc. And on the left, they are bending their neck forwards, or flexion of the neck. And then on the right is the opposite. They're bending their neck backwards, or extension. And one of the things that you can see is when they bend, in flexion, the disc, the artificial disc, is able to close, to collapse, and then in extension to open up. And that's great because we've preserved the motion between C5 and C6. You can also look at the overall shape of the spine and how they're able to straighten their neck out, and then when they extend back, to create that sway, that bend, that normal curve in the neck. And that's great when we're able to take a patient that has an issue, take the pinching off the spinal cord, remove the pinching off the nerve roots, and at the same time put a device in there that maintains the normal mechanics and movement. And many times we're able not just to preserve movement, but to restore some of the lost motion. Interestingly, some of these patients after surgery, not only are they in less pain and so they have more movement because they're in less pain, but also their neck is not as stiff as before surgery because the joints that were diseased have been replaced. And so, these patients go on to have a really, really great function and quality of life. And it often takes, 6 weeks to heal from a surgery like this. In fact, one of the stories that's been published in our local papers here in the greater Dayton area was a patient of ours who we did a disc replacement, and 6 weeks after we allowed her to get back to skydiving. She was part of a team in Middletown, Ohio, and she was jumping out of aircrafts. 6 weeks after, she trained, and her surgery was like in May. By the fall, they competed and won like a gold medal. That team did. So just not too long after surgery, kind of getting back to being very active. Athletes, for example, getting back on the field. Just everyday people getting back to life, and like we like to say at Vertrae, getting back on track. It happens like really soon after surgery. So this is an example in the neck. Now in the low back, there are similar surgeries that we can do to replace the discs in the low back. And as I mentioned, I'm really excited because I think hopefully in 2026 we'll have a completely new device available where we can offer more than we ever have been able to offer as far as preserving motion in the low back and treating back pain. So a lot of exciting stuff happening in this space. That motion first mindset, I think it starts with that understanding of what patients are looking for and putting ourselves in their shoes, and kind of building a treatment plan that's tailored to suit them and their needs, with the ultimate goal of motion in the bigger sense, life and movement and activity and staying, if there are older patients, we focus a lot on just their ability to be able to walk independently, because we know that correlates with longevity and health span, and so we want to keep them active and moving. And so it's that, motion on the level of our tricycle, but then motion in the bigger sense of life and movement and well-being. So there's actually more to be said about this, but I think I've hit some of the high points that I wanted to share with you about our motion first mindset. And interestingly, I just got an invitation to be a part of a podcast that's coming up here, and I'll have a chance to sit with other like-minded folks and talk about this some more. So I'm sure there's more to be said, and the conversation will go on. If you've got any questions, we're happy to answer questions that you may have about our motion first mindset. I hope that this was helpful. Well, thanks for being a part of our second podcast. This is all new, and for us, it's going to be, we're going to learn as we do this. And if you have interest in spine topics, neck and back topics, let us know what you think and what you want us to talk about. And please subscribe to our channel and to like our social media so that we can keep on getting this content out there and engaging with others like yourself.